Welcome back. On this video, we're going to talk about the Practice Ready Assessment Program in Saskatchewan. So in Saskatchewan, the Practice Ready Assessment Program has its own name. It's called Saskatchewan International Physician Practice Assessment, which is the short for SIPPA. So it's SIPPA, okay? So the SIPPA basically is just the Practice Ready Assessment Program for Saskatchewan. And it is known for, again, every program has something that is very attractive and then has something that might not be as attractive. So I'm going to start with the Saskatchewan talking about the examinations that are needed. On the side of things that make Saskatchewan not as attractive as other places is that you need to have the QE1 and you need to have NAC. Okay, so you need to have both QE1 and NAC. So this makes it already a limitation because a lot of people might not have the NAC, okay? Number two is that when you apply for the Practice Ready Assessment in Saskatchewan, they will also invite you to do the TDM. Number three, and in some videos I don't even mention anymore, is that you need the English proficiency tests. Okay, and the English proficiency test, I have a whole video talking about it so that we don't need to discuss any longer when we're talking about licenses now. In terms of immigration status, this is something that might make Saskatchewan very, very interesting for you because they can help you with the PR. So you don't need necessarily to be a permanent resident, and this is a great opportunity for people who don't have the PR yet, okay? Now, on number 5 here, I want to talk about the currency of practice. This is another thing that is very attractive about Saskatchewan because you only need to have practiced for 3 months in the last 3 years, okay? Now, this doesn't mean that you don't need independent practice experience. You do need to have independent practice of at least 3 years, okay? 3 years or more. So 3 years or more of independent practice, and your currency of practice needs to be 3 months in the last 3 years. Now, the other thing that is really attractive about Saskatchewan is in regards to your postgraduate training, where they recognize and accept people with 1 year of independent practice experience. So if you did just an internship, for example, you are eligible for this program on the basis of your training. You need to also have the other requirements, okay? So I'm just gonna go over quickly the highlights of Saskatchewan. So one thing that is really good is that you don't need the PR necessarily. Currency of practice is only 3 months, and the postgraduate training is only 1 year. On the other hand, you do need to have NAC, and independent practice is 3 years, okay? So I put in yellow the things that are more attractive that are here, and in red are the things that are possibly limitations compared to other provinces. So for example, in BC, you don't need the NAC, and independent practice is only 2 years, but then you need to have the 2 years of training of postgraduate practice. So it really depends on how, on your situation. That's why we start with the template, so that now you can know which one is best for you and which one works for you, okay? As I said, Saskatchewan is one of the places that people really like to apply because of the fact that you can, even if you did only 1 year of internship, as long as you have 3 years of experience as a general practitioner, you are able to apply for this program. It does come with a return of service, okay? So after you complete the program, if you pass, you will need to stay in Saskatchewan for 3 years before you're able to go to another province, okay? But it does lead to a full license, and you do not need to be supervised once you pass the assessment program, as all of the other practice ready assessments. Once you pass the assessment during the 3 months, you're assessed, and then after those 3 months, once you pass, you go to a full independent practice, where you're initially on a provisional license just because you have a return of service, and then after you complete the return of service, you can transfer that license as a full independent family physician in any of the Canadian provinces, okay? Hope you liked it, and let's go to the next video.